I'm absolutely going to vote no for this bill, and I encourage all my colleagues on both sides of the aisle, especially those from upstate New York, to vote no for this bill. While it's very big and complex, I know we're at challenging times. Let me talk about the graduate medical education first. What we did, not less money, not savings. We took money, you could call it sweep, shift, whatever word you want to call it. I certainly mean no offense by it other than talk about the merits, and took it to the bad debt and charity pool, which from year to year, most of that money is used in New York City, sometimes up to 75% of it, and took it out of teaching colleges in upstate New York. Syracuse, Senator Valesky's district, Binghamton, Albany, Senator Breslin's district, Binghamton, Senator Libis's district, Rochester, and so on and so on. And this, we should know, if you follow health care, is important even more than the money that the universities are going to lose. Those doctors not only come to our region and often stay there providing the health care, whether you have private insurance or other insurance, but that's how we get our doctors in upstate New York, and even more so into the rural areas. There's almost no chance for them to get there without having that exposure, that education at those universities. Very difficult to recruit without that. That's as real as rain. In the upstate caucus, we had people come in and educate us on this even further, and I can assure you there's already beginning to be a shortage of certain doctors in upstate areas. This is only going to make it more acute. Now, it is absolutely outrageous that New York graduates 20% of the country's doctors, but we're heading towards only doing it out of one part of the state, the city of New York. That is not good public policy, number one. Number two, those doctors, when in residency, are the ones that treat our residents. In my city, Westside Health Clinic, Anthony Jordan, the two biggest clinics that access people that fall through the cracks, don't have Medicaid or slip through it. That's where the doctors come to provide that. Critically important for the indigent as well. And then lastly, I have to say this as a Rochesterian and upstate person, again, this is another example where the policy dollars follow and advantage to New York City at the expense of upstate. That reason alone is enough for me not to vote for this appropriation bill. The second reason, on long-term care, if we really are one New York in one state, like a family, if we had a reimbursement rate, or if you were sending one kid to a college that cost $50,000 and one that cost $10,000, and all of a sudden the other one's tuition went up, and maybe this is a bad analogy, you wouldn't keep spending more on one. You would rectify that by ratcheting down the spending one to get to equality, is the point I'm talking about. We made that pledge knowing that there's an acute crisis in upstate New York, western New York, Finger Lakes area, where I'm from, where nursing homes are literally on the brink of financial disaster or closing while our population continues to age. Our answer to that was nothing. Not only did we not put in more money, we put in less money and didn't even live up to that pledge. That's troubling to me. And it's troubling because I was upset with that before we knew we were getting $6 billion from the federal government that has to be used for this kind of thing. So I really have to say, totally on the merits of this, I would like us to go back to the drawing board on so many areas of this budget, but especially this one. And again, I think if we had conference committees and had a chance to hash this out, talk about it, listen a little bit more to healthcare providers and people that get service, I don't think we would have got to this spot. I really don't. I'd like to think that if we really had a chance to talk about it, hash it out, listen to people, we would have got a much better outcome on this and not had this result. And so while we had people that work in healthcare, get healthcare services, work in hospitals, and do those things, asking us during this process, we had no way to answer their question. Now having this kind of be heaped on us, I can't even go back and say we don't have the resources. We have $6 billion with a B. That's a big B that has to be used for health care. And I would just submit to everyone in this chamber, these are just two important things we've talked about that have not been addressed very fairly. I don't think they're good on policy. I don't think they're fair. And I think that there's going to be a long-term deleterious effect on health care in my part of the world and retaining quality doctors and facilities. And so for that reason alone, I know you don't want me to give you more. I could continue. There's some other things in here I don't like. For those two main reasons, I really feel obligated to vote no, and I hope people will take a long, long look. It's not too late to go back, have a different process, and perhaps do something better and different. Thank you, Mr. President.